Good evening, ladies and gentlemen. Thank you so much for joining us. The presentation will begin in approximately 2 minutes. Good evening, everyone, and thank you again so much for joining us. We're discussing just the facts tonight with physicians from the Old North State Medical Society. I am pleased to welcome to the screen our moderator, Robin Campbell.
Good evening. On behalf of Old North State Medical Society, we would like to welcome you to this important dialogue entitled Just the Facts, a discussion about COVID-19. We are privileged to have a few distinguished physicians who bring a wealth of knowledge and research to this important topic. A few housekeeping rules. If you would like to submit a question, please see the Q&A feature at the bottom right of the screen. Our hope is that you will gain more clarity and understanding regarding COVID-19. Thank you to our partners and sponsors, and thank you for taking time out to be here. Let me introduce our distinguished physicians. Our first physician is Dr. Umar Bowers. Dr. Bowers is Dawson Med's medical director and attending physician. A former Gates Millennial Scholar, he completed training in internal medicine at Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. There, Dr. Bowers participated in health disparities research at the Maya Angelou Center for Health Equity. After completing his training, Dr. Bowers worked in a large multi-specialty hospital-owned practice in Charlotte, North Carolina. After approximately 3 years there, he changed gears and took on the role of medical director for independent primary care practice in southeastern North Carolina. Dr. Bowers currently serves as medical director of Kindred at Home, in addition to being a local medical director for Aladad. Our next physician is Dr. Tracy Ball. Dr. Ball works in Belmont and Charlotte area region. She is an internist, pediatrician, and chief medical officer of an on-call mobile medical and wellness, a mobile medical service available for house calls 24 hours a day, 7 days per week. In 2012, Dr. Ball created On-Call Mobile Medical and Wellness, where she and her colleagues bring doctor appointments to the patient and treat them in their home. During these house visits, Dr. Ball provides adult primary care, pediatric care, and treatment for opioid and other drug addictions. In addition, to the mobile medical practice, Dr. Ball is also medical consultant and member of the Tobacco-Free Mecklenburg Network's leadership team. Dr. Ball also served as president of the Charlotte Medical Dental Pharmaceutical Society, on the board of the Mecklenburg County Medical Society, and an executive board member of Old North State Medical Society. Our next physician is Dr. Karen Smith. Dr. Smith specializes in family medicine in Rayford, North Carolina. For more than 20 years, Dr. Karen Smith has provided treatment for the Hope County residents of all ages through a family medical practice that she owns and operates. Dr. Smith is an avid supporter of social service efforts that address rural citizens, such as food-related health disparities, after-school programs and guidance, substance use issues, and sharing pertinent health information. She successfully implemented electronic health records and telehealth as a part of her delivery of care, which provides acute, chronic, and preventative services to the region's diverse patient population. So we would like to welcome our doctors. And now on with the presentation, Dr. Umar Bowers.
Thank you, Robin, for that introduction. Appreciate that. And thank you to everyone who's taken the time to join us this evening to learn a little bit more, not just about COVID, but also the impacts that it's had, what we have to look forward to. And as we prepare to learn more about the Old North State Medical Society and how it's been involved in the impact and efforts to, I guess, turn the tide, we figured we'd spend just a moment or so to appreciate the genesis of the organization and the genius of some of its founders. And more importantly, just to reflect on the circumstances during which the Old North State Medical Society was actually formed. And in doing so, just offer our gratitude and our acknowledgement of their contributions. Next slide, please. The Old North State Medical Society was established in 1887 by several distinguished physicians. Dr. Manasseh T. Pope, or Dr. M.T. Pope, was one of the leaders, and his classmates. The 1887 timeframe, I think it's really important for us just to take a moment to think about exactly kind of the circumstances that they were living in, particularly in the South. We know that in 1861, 1865, the Civil War was fought. Then there was a brief period from 1865 until 1877 called the Reconstructive Era. And after the contested election of 1876, a lot of things happened, but one of the main things that happened was the Compromise of 1876, or the Compromise of 1877, depending what literature you read. And during that time, the federal troops left the southern states and returned to state rule. So the Southern Democrats enacted measures, which was essentially the ushering in of the Jim Crow era. And that's important to reflect on that, because all of the accomplishments of these distinguished leaders, the men on the screen as well as others and ladies during that time period, were able to accomplish so much under circumstances that probably are hard for us to even fathom. So we'd like to just show our appreciation, show our gratitude, because at this time we stand on their shoulders. And shortly in the presentation, we'll talk about some of the things we've done from the eastern part of the state to the western part of the state and all across North Carolina. But we're really thankful to have a platform such as the Old North State Medical Society because of these visionaries. Next slide, please. We'd love to spend as much time as possible talking about all of the distinguished founders, Dr. Scruggs, Dr. Williams. There's so many things we could talk about, but in the interest of time, we decided just to highlight Dr. M.T. Pope. And he was one of the first in the class of Leonard Medical School on Shaw University's campus. And it's in 1886. So they matriculated in 1882. A few short years later, they graduated. He's known as one of the first four-year medical schools in the entire nation. Dr. Pope was also one of the first African-American physicians actually licensed to practice medicine in the state of North Carolina. In addition to being a physician, Dr. Pope was also a very successful entrepreneur. He co-founded the first African-American owned drugstore in North Carolina called the Queen City Drug Company, which was in Charlotte. And in 1898, he actually was a surgeon and an officer in the Spanish-American War. Shortly thereafter, around 1899, Dr. Pope returned to Raleigh and opened his practice on Fayetteville Street, and shortly moved not too long thereafter to Hargett Street. Notably, Dr. Pope was the first African-American to run for mayor in Raleigh, and quite possibly one of the first African-American mayors to run in a major city in the South. And again, the magnitude of that symbolic gesture, right? The magnitude of those steps that he took, knowing that, you know, his likelihood of winning was zero, but just the fact that he was advocating and pushing forward well over 100 years ago is worth our appreciation. Next slide, please. Here, Dr. Pope and Mrs. Pope are featured with their two daughters. And if anyone's in the Raleigh area or wants to do any research, there's the M.T. Pope House Museum, actually the only African-American house museum in North Carolina. The house still stands with a lot of the original furnishings, a lot of the historical artifacts from Dr. Pope's time as a distinguished physician in North Carolina, time during the Spanish-American War service, and just an opportunity actually just blocks away from the state capitol to appreciate the history and just, I frankly, I'm ashamed to admit, but I didn't even know that Shaw University had a medical school. And having been able to do a deep dive into this work and learning more about Dr. Pope and the Old North State Medical Society founders has been a truly enriching experience. Next slide, please. So what is the Old North State Medical Society and why was it formed? It is currently a platform originally formed and now presently to this day, originally to fight segregation and discrimination in healthcare, public policy and beyond, advocating for the education and training of African-American physicians, as well as the health of the African-American community at large. Those were the initial tenets of the organization. Nowadays, the Old North State Medical Society is very active, but it's expanded its mission to help people that are vulnerable due to low socioeconomic status, peoples of color, communities of color, people with a lot of social determinants of health. And the organization, as many have in the 100+ years, has progressed to helping wherever there is a need, beyond the color lines, obviously. Next slide, please. So why was the Old North State Medical Society formed? It may seem obvious. We're hearing now a lot of DEI, a lot of work with corporations and county governments and state governments in the space of DEI, but their world was different. Their world was discrimination, exclusion, and injustice. That was their DEI. And in this undated photo, we see the esteemed founders and others with pride, but their struggle was still something that they bared on their shoulders. They were not, unfortunately, able to join the North Carolina Medical Society, which was the state constituent of the American Medical Association. So in essence, of all the things we talked about in the previous slide, the Old North State Medical Society was formed out of necessity because they weren't allowed to join the predominant North Carolina Medical Society. And then in other times, they were maybe able to join as partial members, but not as full members. And so born out of necessity, but the passion and the desire to help all. Next slide, please.
Established in 1887, the Old North State Medical Society's founders were proud to launch what would become a legacy that helped to shape our state and nation. Old North State Medical Society was founded at Shaw University's Leonard Hall, the first four-year medical school in the nation. Today, we continue the work of educating and advocating to improve public health outcomes across the state. Our physicians are uplifting communities throughout North Carolina. Join us as we stand together and continue to make history.
That was a commercial that's been running during February, obviously Black History Month. And just, again, having the opportunity to visit Shaw University's campus and the history of learning about the medical school and the college was really enriching. And we figured before we kind of hop into the meat of the program, just take a moment to muse and just imagine 100+ years later, if the founders of the Old North State Medical Society and their contemporaries were sitting with us today, what would that conversation look like? We know that they fought for a seat at the table. We know that they fought for equal access to medications, equal access to the most up-to-date medical treatment, equal access to compassionate care and clean facilities, equal access to vaccines. What would the conversation be like in 2022 with these distinguished leaders? My imagination is that they'd be amazed at how far we've come, but also I think they'd be determined to push forward and continuing to drive down some of these inequities and disparities that exist. So thanks for letting me take a moment back to honor and acknowledge the founders of the Old North State Medical Society. And now I'll pass it back to Robin.
Thank you so much, Dr. Bowers, for sharing such rich history with us about Old North State Medical Society. Next, we will hear from Dr. Tracy Ball.
Thank you for that welcome, Robin. And Dr. Bowers, thank you for taking us on that excellent journey of the history of Old North State Medical Society. So here we are over 2 years in the pandemic. How did things begin? Where are we currently? And what we look toward as the future moves on? Well, looking back to the beginning of the pandemic, in December of 2019 in Wuhan, China, there were several cases of a strange pneumonia that were identified by medical experts there, connected with a seafood market. Soon, other cases began to be found within that city, and they realized that they had a new virus on their hands, which would be known as novel coronavirus, or come to be known as COVID-19. In January of 20, we began to see our first cases of coronavirus on US soil. And as those weeks went on, we soon realized that this was not just limited to a few countries, but soon there would be cases in Thailand and Japan, and that we were in the midst of a worldwide pandemic. In February of 2020, we began to see that the coronavirus was not just one variant. Soon other variants would be formed and come out to lead us to our current most common variant, which is the Omicron variant that we're seeing. And here we are in February of 2020, and we've seen tremendous impact of the coronavirus, from the record number of cases to the hospitalizations that have strained our healthcare system, and unfortunately, over 6 million plus deaths that have occurred, unfortunately, due to this virus. Next slide, please. So when we look at mitigating or reducing the risk of this virus, we were looking at 4 areas. The first area we looked at was prevention, second, detection, third, treatment, and then the fourth, evaluation. So one of the things we want to do is to look at how we can prevent the spread of the COVID-19 virus quickly. And one of the ways that was done is through locking down our country's borders. That was done rapidly, and then we soon realized in the US that not only did we need to lock down our borders, but we also needed to restrict travel state to state to prevent spread. We then became introduced to the 3 W's, wearing a mask, washing our hands or using sanitizer, and then waiting or creating some distance in between one another as we're out publicly. That will soon become known as social distancing. We also realized that we need to quickly detect this virus. The PCR was first used to do that. Unfortunately, through the efforts of multiple companies, we were able to have rapid testing so we could quickly identify, quarantine, and isolate those who had COVID-19 to help reduce spread. And then looking at treatments. What treatments were available? And fortunately, we were able to have them develop monoclonal antibodies, and now most recently, oral antiviral medications that can be used to quickly get someone treated who has COVID-19, and even to use pre-treatment options for those who may be at high risk. And then how do we evaluate those strategies so we can quickly see if they're effective and modify them if necessary? Next slide, please. So pandemic versus endemic. Pandemic means that we'll see this virus, it'll be here, we'll be able to eradicate it, and then we'll be able to move on. Endemic means that we would see this as part of our new normal. And just like the seasonal influenza or flu virus, we would have to be vaccinated and have cases of COVID-19, at least most likely seasonally. So what have we learned from the current pandemic? So again, we're going to look at those 4 areas of prevention, detection, treatment, and then evaluation. So in prevention, we realized that we quickly need to be able to gather data and be able to assess that data so we can quickly come up with measures to not only be able to identify, but also to treat. We need to be able to come up with quick interventions for COVID-19. And then we need to be able to distribute information. We found that social media, although unfortunately being a resource for disinformation and misinformation, but it was also a great resource for spreading information as well and getting quickly information to the public. Next slide, please. Detection, we realized that we need to come up with new ways to detect. So what can we possibly look at to help us with that? Well, the role of artificial intelligence. For example, we may be able to predict where the next outbreak may be so we can quickly intervene and help reduce spread of COVID-19. Also, we realized that there were community advocates such as with the Old North State Medical Society physicians who quickly responded and were able to start testing in 2020 and then continue those efforts with vaccinations and testing currently. And then we realized that we need to help funding and get resources to those community partners and global partners as well, and realize that there are other professionals that we can help engage in these efforts, such as our community pharmacists, our EMTs, and several other healthcare professionals. And then when we look at treatment, we realize that now that we have this information, we need to be able to identify other treatments. As we've seen, some treatments of variants have come along and changed and evolved and become less effective. So we need to be able to quickly identify ways to create new treatments. So looking at biomedical drugs, looking at the genetics of not only the person, but also the variant to more effectively treat someone. And then finding out ways that we can deploy these treatments. As we saw with doing our pop-up and local clinics, that we can effectively deploy teams out with tents, pop-up clinics, and even having extended hours with our local stationary clinics to more effectively getting those treated. Next slide, please. So what's next? Is there a possibility there is a COVID-20 in our midst? So what do we need to do to prepare? One, we need to identify and recognize that there are future threats in our future. That there could be a COVID-20 and possibly a 2021 waiting for us in the future. We need to find ways to use predictive models to help identify what those threats could be, and then find ways to prevent them, treat them, and again, evaluate them. And then we need to learn that we need to work as a team to reach across not only racial lines, but party lines, and even a race across organizational and business lines as well. Thank you, and I appreciate you for taking this opportunity with me to share this information. That concludes my presentation.
Thank you so much, Dr. Ball, for sharing the timeline of COVID-19, as well as prevention, detection, treatment, and treatment options. Next, we will hear from Dr. Karen Smith.
Thank you, Robin. I really appreciate that introduction. It is a wonderful honor to talk about the economics of the COVID pandemic. And if we move to the next slide, we will see it has had an impact on our households. When we first received the announcement, and we all heard about there was a change in global health and well-being in our country because of this unknown virus, the coronavirus, and that news came out, as my colleague, Dr. Bell, has already stated, December of 2019, but the rest of us, we found out about it around March 11th. And that's when the World Health Organization made their announcement. And then our country, March 13th, said, yes, we are in a pandemic. And the reaction started. March 15th, we started closing our restaurants, our schools, and we were told, be careful, shelter in place. The change in our economics started on that very day. Next slide. But is America ready to move forward after being in this COVID-19 pandemic, which by the way, we still are? So what are some of the indicators that we utilize for economic recovery? Are we going back to work? Therefore, has the unemployment rate actually declined? And then are people actually earning enough to make a living? Has the stock market returned? And are people traveling? Are they feeling comfortable to actually move out of shelter in place? And that's what we're going to talk about today. Next slide. But we're still recuperating. People have suffered from COVID-19. Some people had the COVID long haul syndrome. And so whether we desire to move forward, are we well enough to move forward? And that is going to make a difference in terms of our recovery process in regard to the economics of COVID. COVID-19 was the third leading cause of death in the United States when we looked at the data from 2021. And the cases continued to still exist. Next slide. But let's look at our first quarter, 2022, where we are now. And unfortunately, we saw that there were 215,000 people who lost their lives. And what about North Carolina? We had 21,580 people. And we did see an increase. Even as the data of February the 10th, we saw a spike. Yes, it was Omicron. Omicron was not as sickly, shall some people will say, but it was COVID cases still being recorded and death due to COVID. Next slide. So who did we lose? Who perished as a result of COVID-19? When we look at our numbers, 65% of the COVID-19 deaths that occurred were in non-Hispanic white people, yet they make up 60% of the US population. But there were other groups who also suffered great loss, particularly non-Hispanic groups, Black, American Indian, or Alaska Native, and our Native Hawaiian and Pacific Islanders. Death was beyond what we would have anticipated for the population numbers that reside in our country. Next slide. North Carolina, first quarter 2022. And then here it is, our numbers again. But let's look at our vaccination. 82% of people have received the first vaccination, at least one dose, and then fully vaccinated, 59%. And this data was most recent, again, February 10th, but still enough for us to pay attention to some of the numbers. Again, Old North State Medical Society made a difference, as my colleagues have already noted. Next slide. So let's look at the data. What about the unemployment status? Well, at the beginning, we saw there was a large increase, and we see that in our curves of people who were not able to go to work because their jobs had closed. They were told to shelter in place. And so the unemployment claims now is at 1.6 million throughout the country. In North Carolina, we're still at 16,000. So we haven't quite gone back to our baseline, but we're awfully close to it. Next slide. Housing, that's another indicator. And when we have housing insecurity, and 4.1% is what North Carolina is currently at, that means individuals who do not have a home they can call their own. And then when we look at our national homeless population, unfortunately, we see a little increase in that curve. And this is an indicator that makes a difference. Next slide. But what about our personal income? How much money are we earning, and are we able to make use of that money? Well, interestingly enough, in December, we did see an increase of 11% in terms of the personal income. And I thought also interesting, when we look at our national savings rate, when we first received news that COVID-19 existed, people saved money, or they couldn't go anywhere and spend the money, one of the two. We figured that out. But then when we look, we start to see that the savings has declined a little bit, but still up 7.9%. Next slide. Health insurance coverage, that is very important, because as people were not able to work or perhaps didn't have a job, our health insurance in this country is still tied to employment. And so we did see that those numbers came back up. And we also look at our private insurance in terms of people who are covered, and the public insurance. The neat thing about this slide, if we look around the year 2015, we start to see a reversal in a trend. And we know what happened about then. So we are appreciative of our previous, our leaders who allowed us to have health insurance. Next slide. What about current inflation? Now, this is where we are looking at the data. And I started with the worst, gasoline, because that's what you see when you go to put fuel in your cars. The prices for gas has increased 40%. And that makes a difference. For those of us who remember the days when the pumps were closed. But gas is beyond just putting fuel in your car. It also, for some of us, heats our homes. And then what about those truckers who are moving goods from here to there? They have to pay for the gas. Their costs go up and our costs for goods go up. And that's what we're concerned about. Next slide. Food and housing. Our food and beverage rates have gone up 6.7%. Our housing, 5.7%. These indicators make us pay close attention to recovery indicators. Next slide. But then let's think about, where were we before the pandemic even started? Who were the families who were already in poverty? And we see our single mother households were already in poverty. And then what about the race and ethnicity? Black and Hispanic people were already in poverty before the pandemic even started. That's going to make a difference in terms of recovery. Next slide. Gross domestic product. That is, are we producers or are we users in our country? And when we look at the top 4 indicators, health, education, those are in the top 4 category. And those are the ones that matter. But why are we spending so much in health? And yes, we need to spend in education, but are we getting the quality for both health and education? Well, when we look at our next slide, we see that there's going to be some concern, because you see, in this most recent quarter, we were minus 3.5. We were users, not producers. And it takes 2 quarters of being users in order to define a recession. And that's where we are today. Next slide. Well, we don't want to be in a recession. We don't want another quarter where we have a negative GDP, gross domestic product. So what are we going to do? We're going to connect. And I encourage each one of you to look at those opportunities, to connect with the folks who make a difference. join those associations and be part of the conversation. And that's the communication. Let the leadership know, and you be the voice in terms of what is happening in your own home, your household. And then when we come up with the policies that you helped to develop, that your vote made a difference because you selected the leaders that was going to work on your behalf, we're going to collaborate. And we're going to come together and follow those policies, and let's make a difference. Because you see, that is what Old North State Medical Society did. We collaborated with all of the other medical society organizations and the Department of Health and Human Services for North Carolina, and we saw success in at least getting COVID-19 under control. Thank you.
Thank you, Dr. Smith. I appreciate you sharing that information with us. And we also need to think about the psychological effects that COVID has had on us as well. And we definitely need to connect, communicate, and collaborate. Now we will hear from Dr. Umar Bowers.
Thank you, Robin. And again, thank you, Drs. Ball and Dr. Smith, for your remarks. It's interesting, the financial impact of COVID will be remarkably different as we continue to explore the next several months in light of the world events and the geopolitical events over the past 24 hours. So I'm interested in seeing Dr. Smith's updated slide deck in a few months. Hopefully it won't look that much worse. Next slide, please. So let's talk about health equity. Let's talk about impact. Let's talk about some of the ways that the Old North State Medical Society has made a difference with its COVID-19 equity project over the past several months. North Carolina's Chief Health Equity Officer, Mr. Victor Armstrong, states it very eloquently: health equity only exists when all people have the opportunity to attain their full health potential, and no one is disadvantaged because of their social position or other socially determined circumstance. And some of the words that I pull out of this is opportunity, all people, and disadvantaged. Next slide, please. Ipso facto. So we call this presentation just the facts. So let's talk about a few simple facts, regardless of how you feel about COVID, regardless of how you feel about certain chronic comorbidities. COVID-19 has clearly had a greater impact on individuals with chronic medical problems, such as morbid obesity, uncontrolled diabetes, uncontrolled high blood pressure, uncontrolled COPD, or other restrictive or obstructive lung diseases. That's a fact. The numbers bear that out. That's not debatable. It's not negotiable. Generally speaking, who are these people? Who are the people in the United States of America that have the highest rates of uncontrolled diabetes, highest rates of morbid obesity, the highest rates of uncontrolled COPD, the highest rates of uncontrolled hypertension? By and large, those are minority populations. By and large, those are populations from Black and brown communities. By and large, those are people who have been most vulnerable to the adverse impacts of COVID-19. And add to the diagnoses that we just mentioned, the handful of those diagnoses that sometimes we see one or two of them, some individuals have several of those. Add to that limited income. Add to that unstable employment, just like Dr. Smith just mentioned. Add to that perhaps residing in economically deprived areas, challenges with transportation, childcare limitations. So then you can see how COVID-19 can have a disproportionate impact on certain groups of people, although we all have conceivably the same access, right? Conceivably, but we know that's not necessarily true. Next slide, please. Presidential COVID-19 Health Equity Task Force in its early studies indicated communities of color and other underserved populations have experienced disproportionate rates of infection, hospitalization, and death due to COVID-19 and related complications. Now, later data bore out that the death rates amongst African Americans weren't necessarily disproportionately high, That's mortality, but the morbidity amongst underserved populations, the morbidity amongst marginalized communities, the morbidity amongst those that we would call vulnerable is clearly high, even though the death rates may not be. Next slide, please. Enter the Old North State Medical Society, knowing that the early data showed that there was a disproportionate rate of morbidity and mortality, hospitalizations, infections, and death amongst certain vulnerable populations. Perhaps the numbers didn't continue because of the impact of certain well-intended groups across the country, the Old North State Medical Society being one of them. The Old North State Medical Society partnered with the Department of Health and Human Services here in North Carolina and was able to successfully administer tens of thousands of vaccines throughout North Carolina, from initial vaccines to second vaccines to boosters and on. And it has been an undertaking that has been oftentimes thankless, but knowing that the public health impact would be difficult to measure, but with tens of thousands of vaccines administered, we can extrapolate what that benefit has been. And the Old North State Medical Society in general, and the COVID-19 Equity Project physicians are incredibly proud to have partnered with the North Carolina Department of Health and Human Services and having done some of this work. Next slide, please. As you see here, a few of the physicians that were active over the past several months from the Winston-Salem, Greensboro area, Greenville, North Carolina, our colleague, Dr. Knuckles, Dr. Hargett, who's actually the medical director of this particular project in Jacksonville, and the three physicians on the call today. And just to have the opportunity not to just be a part of the project, but to have witnessed the collaboration, again, as Dr. Smith mentioned, and the camaraderie and the willingness for wherever these physicians may have been in the state, if there was a program or an event that was hundreds of miles away, they would mobilize their team, they would mobilize their resources, and they would get in the car, get in the van.
Dr. Bowers, your sound. Okay, I think it's back on.
While we're waiting for Dr. Bowers to reconnect, you may want to check and see if any questions have come in from the audience through the Q&A, and remind people how to submit questions to the physicians.
Okay.
Can you all still hear me?
Now we can hear you.
Okay. I'm sorry, I lost audio for a moment. Sorry about that. Well, I was just sharing on this particular slide that the physicians throughout the state of North Carolina may not have been located in the same area, but did not hesitate if there was an event or an opportunity to help collaborate and make an impact. And I've seen that and was humbled by the selfless efforts of the colleagues pictured here. Next slide, please. This is recent data from CDC that kind of bears out the COVID-19 deaths over time. We can see here that the deaths on the far right are trending down, thankfully, but they're still very, very high. The peak was in January, we'll call it December.
Robin, are you there?
Yes, I am.
So while we're waiting for the connection to come back, we've had a request if you could actually prompt some of the questions to the physicians.
Okay, I will do that.
All right, clearly I'm
Okay.
unstable, so that makes sense.
We do have a question that someone had submitted, and I would go ahead and like to pose this to the physicians. Please direct COVID-19 management for older people with immune disorders. So what would be your feedback on that? And any of the doctors can answer this.
I would be happy to
COVID-19 management for older adults.
Happy to take that. So for those that are immunocompromised, and I'll not just address those that are older, but for now 12 and older, CDC has recommended that there are a total of 4 vaccinations that they can receive. So if they've received Moderna or Pfizer, that will be the first 2 doses. If you had Pfizer, you would have your initial dose, your second dose, 21 days later. 4 weeks later, you would be eligible for your 3rd dose. And then approximately after that, then you could receive your 4th dose. And then if you had Johnson & Johnson, you would have acquired your 1st dose. Your 2nd dose could be 2 months later. And then you would be eligible for your 3rd dose of the vaccination.
Okay, thank you. Next question. Once the period of COVID-19 variants passes by, what is the likelihood of another pandemic like this one in the next few years?
I'll go ahead and respond. We are currently seeing another variant that has been identified, but this variant, again, is very early in the phase. But I believe the question is, what is the likelihood of another pandemic? Our concern is real. And so what is happening at this time that our national leadership is preparing to make sure that we have the information well in advance to know what to do, that we have the supplies that we need, that we're taking the lessons learned and making sure that those lessons are added to new policies that are being developed. So there's likelihood of a pandemic, whether it's another COVID type pandemic, or whether it's similar to the influenza that we saw in 1918. The bottom line is we won't know the name, but we definitely need to have preparation.
Thank you so much, Dr. Smith. Next question. At what point is the treatment worse than the disease? When do we start to understand the damage masks have done to children? So who would like to take that question?
And this is Dr. Bowers. I'm going to try my best. Can we pull up the slide that showed the differences in death rates amongst those that are vaccinated? It'd be the next slide. I'm so sorry for these technical difficulties. I'm traveling and I do apologize to the audience. So this is something that we have to take a look at, and different people have different perspectives, different viewpoints on the vaccines, and that's certainly respectable. There's a lot of information out there, and sources sometimes may lead you one way or another. But one of the things that, again, that's not debatable is the death rates from those who are unvaccinated compared to the death rates of those who are vaccinated. You're over 40 times more likely to die if you contract COVID and you're unvaccinated. Those are the facts, right? Those are just the objective data. These are blinded. This is not necessarily, this is CDC data, by the way. Right, this is not necessarily something that is to push an agenda. This is not even to encourage you, to be frank, to get a vaccine. This is just the data that shows these are the death rates in the United States from those who are unvaccinated compared to those who are vaccinated. So it's hard to imagine, based upon the 40 to 41% likelihood of dying if you contract COVID being unvaccinated versus vaccinated. It's hard to imagine that the vaccine is worse than the illness.
Thank
as
you
far
so
as
much.
Sure, I would only say to the second point of as far as the masks and damage to children, I believe that would be something perhaps Dr. Ball or Dr. Smith with more pediatric experience might be able to tackle. But we have been throughout this process very concerned about a lot of the things, from social isolation and restrictive measures in the interest of public health. So there's always a give and take. But as far as damage to harm to children, I must admit that I have not seen that data.
Okay, thank you.
I would echo that that Dr. Bowers has already said about children and mask wearing. Again, I think the benefits of our children having some protection is going to outweigh the current risk, and we haven't seen anything detrimental, any information showing us that there is a concern that we should stop the use of masks with children currently. And then I would look anecdotally, we can look at children who have other conditions which would require them to wear a mask from time to time. So our children who may have been immunocompromised from a medical condition or a genetic disorder, and those children for some reason may need to wear a mask. Most commonly, it's to benefit them from developing or acquiring an infection that could cause them serious harm. When we look at those children anecdotally, we do not see any long-term risk or harm to them. Again, the benefit of them wearing that mask is more protective and more beneficial to them than harmful.
Okay, thank you so much, Dr. Ball. And there's one other question in relation to a newborn that maybe you can answer for us. Can you discuss traveling with newborns? The person said, I am getting conflicting information from so many different experts. So would you happen to be able to give us some feedback on that?
And that question is a little vague. I'm not sure what they're asking.
Mm-hmm.
Maybe if the person is present and they can give a little more information specifically about what they're looking for, then we could probably answer that question a little more effectively for them.
Okay, thank you. And I'll see if they do respond, I'll definitely let you know so you can get some clarity. Another question that was submitted, is there a clearinghouse for COVID-related resources available for communities? How would someone request ONSMS vaccine van help?
And I can go ahead and respond to that. The
Okay.
North Carolina Department of Human Services has put a wonderful website together. And it has information, whether you are and just want to know about your family, or maybe you are a owner of a business and you want to know what to do for your business, your employees. The information is absolutely broken down in a manner in which it gets understood. Not a whole lot of the medical, but a lot of information that makes sense. I also appreciate the information on education for educators and for parents who want to know, can I send my child to school safely? And what about the mask? Is it necessary to continue with the mask? Do I need to be part of that school board meeting that supports and advocates the protection and safety of my child when my child is in the classroom setting? And so the information is there. If you want to get into the data, as I tried to do a little bit of tonight, we know that the CDC website has quite a bit of information on data and breaks it down. So there's several good, reliable sources. I haven't quite gone to Facebook yet to look at that data, and I'm not quite sure I can say that's data that I want to talk about. I don't have any way to verify that information. And so that's what we're seeing in terms of the information that is available. If you would like us to come to your community, our vans are ready to go. We've done the maintenance. We have the fuel. It was a little costly, but it's been done. They're loaded up. And just reach out to the Old North State Medical Society. You can certainly go on to the COVID response website, and one of our team members in what region of the state will be there. And yes, we cross territory because I've been up in Durham when I had colleagues who were busy working over in Wilmington.
Thank you so much. We have another question. I have been fully vaccinated and boosted, but over the past couple of days, I've noticed an intermittent dry cough. Should I get tested for COVID or see if there are other symptoms?
Well, I can go ahead and respond to that as well. Watch your symptoms. And so if you've been fully vaccinated, you've been boosted, watch your symptoms. Influenza is still out here, the common cold, rhinovirus, that didn't go anywhere. And some of us are in areas where the trees are already starting to blossom. And so the allergies can be there. Monitor your temperature. Look for other symptoms in terms of if it's a GI upset. Does your cough come with a very severe sore throat? So look at your symptoms. But the number one thing that I will say is contact your family doctor, please. And when your physician provides you with information, definitely give feedback, but try to take the advice of your doctor. We're so very much interested in making sure that people get through COVID in a healthy way without loss of life. I encourage you, please reach out to your doctor and ask these questions of your physician.
Thank you so much for that response. And one more question and comment. Excellent presentation and discussion. What are the physicians seeing in terms of routine screenings for chronic health conditions, i.e. cancer and other health conditions?
I'm happy to try to take a stab at that one. I think that's a great call out because essentially, because of some of the social distancing and precautions we've seen over the past couple of years, we've seen a decreased number of mammograms performed. We've seen a decreased number of colonoscopies performed. We've seen a decreased number of pap smears for cervical cancer screening. And the projection is that over the next several years, we may be unfortunately seeing illnesses or cancers that could have or should have been caught with screening. So as Dr. Smith was mentioning, follow up with your primary care provider for whatever illness you may have. Also make sure you touch base with them to see if you're overdue for any preventative screening things, because that's really important for us to try to catch up. We won't be able to make up all of the missed ground, but catching up on some of that lost time, essentially a year and a half or so of missed screening opportunities, can have a negative impact for our health in the future.
Thank you so much, Dr. Bowers.
Can I add to Dr. Bowers' comment regarding routine vaccinations that are not COVID vaccinations? Please, parents, get your children up to date on their vaccinations. And during this COVID pandemic, we did see a decrease in those vaccination rates and the adult vaccinations. Please get up to date on your vaccinations. We already spoke about preventing issues. Vaccines are part of preventive medicine.
Thank you so much, Dr. Smith. And this kind of answers this next question. Is an additional booster needed?
At this time, we are seeing that there's a possibility, as many have seen on the news, that we may need to incur what they're calling for some who are outside of those that are immunocompromised, what may be known as a fourth booster. And so time will tell. Again, it's still early. We have to look at the data. We know that we are still in this current surge. It's still going. We are, as fortunately, as shown on the graph, we are seeing some drop in the numbers, in the number of cases, in the number of hospitalizations, as well as fortunately in the number of deaths. But we really won't know that data until some months out, and then we can see where we are in the current pandemic.
Okay, thank you so much, Dr. Ball. And now we are going to go back to Dr. Bowers to share another screen.
Well, as we wrap up these amazing points that we've learned and discussed and shared, just one graphic that we wanted to share, and that is just a few weeks ago, as of February 4th, North Carolina data says that only 50%, or obviously 1/2 of African Americans in North Carolina had at least one dose. And if we think back to the slide we saw a few moments ago that said that you essentially have a 40 to 41% higher likelihood of dying from COVID if you're unvaccinated. And we think about earlier in the presentation when we talked about the Old North State Medical Society founders, and what would they say if they were to sit with us today, knowing that they were fighting for the opportunity to be vaccinated just like everyone else, fighting for the opportunity to have equal opportunities in the public health forum, equal opportunities in their communities, to be just as safe as other communities. there's work to do. There's always room for improvement internally, externally, but this is something that we wanted to keep in mind, is that COVID is dwindling, COVID is winding down, but COVID is not gone and COVID is not over. So the benefit of vaccines, the benefit of being vaccinated in your household, in your community, is still something we would ask you to consider and discuss with your provider.
Thank you so much, Dr. Bowers. And there's one more question that I overlooked, and it says, how do you feel about all the reports regarding CDC not releasing all the information? Is there anyone that would like to address that? How do you feel about all the reports regarding CDC not releasing all the information?
I will go ahead and address that because I do a lot of work with our legislators. And I'll be very honest with you. Our leaders get a lot of information. They get a lot of data. If they released all the information that they get, I wouldn't know what to do with it. And when we look at our presidents, they turn gray hair within how many years? 2, 3? Okay, so clearly they're getting a lot of information. But the question is specific to that of CDC. CDC gets a lot of information that they must go through, review, and make sure that that information is reliable, that is valid, and is the information useful? And so I'm not familiar with the concern of CDC not releasing all of the data, but I am familiar with the information I received. And the information that I received was definitely useful. We were able to implement it in our communities. I used it to help educate our patients and the people who ask questions of us. The information that we received made sense, and we were able to use it. So I'm very pleased with how our CDC and the Department of Health and Human Services in North Carolina and all of the efforts from our medical societies across the state came together and allowed us, the physicians, to provide you with good quality and timely service to prevent loss of life from COVID-19.
Thank you so much, Dr. Smith. And I believe that is all the questions. Let me just double check. Let's see. One last question, I promise. What update can you share about the Omicron subvariant?
We do not have that information. We're only made aware of it. We do not have this what's called surveillance data to give any more information. And again, we don't want to put myths out. And so until we get data that's validated, that we can share, that we know, again, information that makes sense, then we can further review it. But at this time, the surveillance data has not been provided to us to use in our communities.
Thank you so much, Dr. Smith. So now I'm going to pass this to Hugh Halston.
Hello, Robin. Thank you so very much. I think things are going so well that we may be able to take some additional questions from the field or have some questions that might have been submitted previously.
Okay, I'd be happy to do that. There's a few more. Just want to be sure that we answered all the ones from tonight. Dr. Bowers, is a breakthrough case of COVID-19 for a person who has been vaccinated and received boosters still just as contagious and easily transmitted?
That's a great question. Thank you for those who submitted these questions in advance. And I guess, we would ask ourselves, what is the definition of a breakthrough case, right? Because when we think about the flu vaccine, that doesn't necessarily mean you won't get the flu. It decreases your chances of dying from complications related to the flu. And similarly, when we've advocated for COVID vaccines or vaccinations against COVID, SARS-CoV-2, we're not saying that you won't get COVID. We're saying that there's a less likelihood that you're going to die or have a severely adverse outcome from COVID. Similarly, it's less likely that you will spread it to someone else, but that chance is not zero. So if you are vaccinated, with the presumption that your titers are still high enough to provide protection, because titers wane over time, there is data that shows that's why this booster discussion and whether or not there's going to be a fourth shot, that's something that scientists are throwing around. So that's a fair question. So depending on where you are and how long ago you were vaccinated, whether or not you've been boosted, your titers can be at certain levels in which you may actually be contagious. You may be mild, you may have mild symptoms. But either way, there is the possibility of virulence, of spread of your respiratory droplets. That is possible. So all we try to do, as Dr. Ball mentions, is we try to mitigate. We try to decrease the likelihood, decrease the chances. Nothing is 100%, right? If you're vaccinated, there's absolutely no way that anyone will guarantee that you won't get COVID and you won't get sick. But the likelihood of you getting it and getting sick, the likelihood of you getting it and spreading it is less.
Thank you. The next question is for Dr. Ball. What is the best type of mask to wear to prevent spreading COVID-19?
Well, as been recommended by the CDC, changing to a surgical mask. Those are the masks that we see on our favorite medical shows, Grey's Anatomy, for those of us who are a little older, ER, if you remember the flashback to ER, those masks. And then if you can, then moving to a N95 or a KN95, which will have a higher rate of filtering out particles in the air. And that's what we want to do to help reduce chance of acquiring an infection.
Okay, thank you. Dr. Bowers, is it possible there will be other variants beyond the Delta and Omicron variants that we're seeing now? And I believe Dr. Smith kind of touched base on that, but is there anything that you would like to add to that?
I would say the science is still developing as we are basically standing up global surveillance in a way that we never had before. There's always been surveillance. There's always been arms of the World Health Organization in countries, but never the magnitude of which we've seen over the past couple of years. But certainly there is concern that there could be another pandemic. And in fact, it's almost inevitable. The question is, what will it be and when will it occur? Will it occur in our lifetime? And what will the magnitude be? We hope that's not the case, but we certainly cannot take that off the table.
Okay, thank you. And we have a couple more questions that have been submitted just now and one comment. This has been a great session and the information is very useful. And our next comment is faith plays an important role in the lived experience of African Americans and other race and ethnic minority groups. What is your recommendation for churches and other houses of worship in terms of holding in-person worship services? This is a great question. Is there anyone that would like to answer that one?
I can answer that one. I actually serve on the COVID-19 task force for my local church and some other churches, and assist them with helping making those changes that possibly need to be made to continue to hold services. One, I think, is innovation and being willing to evolve. And that's where we see technology. A lot of churches have moved to virtual services to incorporate them as part of their worship. The other thing that has been implemented is screening, pre-screening with questions prior to those visiting the church, using temperature checks, passing out masks or requiring masks be used within the service or when they're inside the building is another great measure. Using purifiers inside the service areas, the fellowship hall. Those are great measures that can be used to help purify and cleanse the air, so to speak, for those, especially if there's a singing that may be going forth as part of the service. And then not lingering. And I know that's a great part of church is the fellowship part where we're shaking hands and hugging and gathering together. And so there are some times that you may need to reduce the amount of time of lingering inside, and also have some policies where you change the way you give out communion so that there's not a sharing or a touching of those communion cups or the bread that may be passed along, using a different way to take up collection. Also, instead of passing the collection plate, you may have those give virtually, using, some churches are using Cash App, Venmo, a variety of payment vendors now, or either walking around and reducing maybe the number of hands that are touching, and even using gloves when necessary, is some measures that we have implemented personally in my church, as well as some other churches that we have consulted with.
Okay, thank you. That's really great information, because I know that question is on a lot of people's minds. The next question that we have, does natural immunity without a vaccine or booster shot provide the same level of protection?
I can answer that one. So what happens when a person contracts COVID and other viruses, the body has an immediate response of the antibodies. And this is where folks kind of get into trouble, because how quickly those antibodies are made in the body determines how much impact the virus will have on that individual's condition. So the body is ramping up, and these are individuals who have not been vaccinated. This is a brand new a foreign agent to the body. So the body recognizes this as foreign. It starts to ramp up antibodies. Now, these are the immediate response antibodies. They don't last too long. And when I say 90 days, that's about it. Because these antibodies are there for immediate response. So when a person has not been vaccinated, and if they have made it through not having severe disease, they are going to have some antibodies present for about 90 days. But then these antibodies, they go away because, again, they were immediate reactors. And that's where people may get a little confused, thinking, well, I have now developed that natural immunity for 90 days. And what we're saying is, please get vaccinated so that we can stimulate antibodies that last longer than 90 days. And then if you do encounter the virus, the antigen, your body's going to say, I've been there, I've seen that, I know what this looks like. Those antibodies are going to kick in and start working for you immediately. So be careful with natural immunity. It's not going to last as long. And do you have enough time to make enough antibody so that you don't get into a compromised situation with severe illness and loss of life because you didn't have enough time to make enough antibody?
Thank you for that. We have 2 more questions that came in live. I want to commend you for the information on tonight. I was very pleased. I'm very glad to work in schools. Now that masks are optional, I want y'all to know that the students still want to wear their mask. Now, that's more like a comment, I guess. So that was someone that works in the school system. Is there anyone that would like to comment on that?
I would love to, and I'll first kind of piggyback on Dr. Smith's comment a moment ago about natural immunity. Another term for natural immunity is innate immunity. And actually some studies were just released over the past week or so, helping to explore the mystery of why is it that children did not seem to be affected at the level that adults were. And the studies showed that the reason why children did not, by and large, get affected as much was simply because they have more of innate immunity, more of a natural immunity or an innate immunity response to the insults, right, when COVID hits their body. However, they can still be vectors. So, and as a nod to all of those working in the school system, as a nod to all of those who are vulnerable but working around children, right? We want to wish our condolences to those that may have contracted and had a bad outcome, but looking forward with the mask mandates being relaxed in a lot of the schools, some children may certainly continue to wear their masks out of their own choice, but some will not. And still we have to be mindful of the fact that although these children may not be impacted as much, the adults in the classroom or the adults in the building can still be affected. So, you know, we are thankful to our educators and those that work with young people throughout the day, and the innate immunity that children have isn't always shared amongst adults.
Thank you, Dr. Bowers, and we are thankful for our educators. And we have another comment. Thanks to the presenters, this has been excellent presentation to help the attendees share information. And one more question from our pre-submitted questions, and this goes to Dr. Bowers. Is it true that the Omicron variant is less severe than the Delta variant and you're less likely to become severely ill?
That is a distinct possibility, but in this work, we don't like to guess. In this work, as Dr. Smith mentioned, we are talking about science, not something that you found in a web search and decided to broadcast it to everyone in your network. That's the speculation. However, what we haven't done with all of the testing is actually done the subtype variants. So therefore, what we saw over the past several months was an incredible surge. And the suspicion is that this was Omicron. That is clearly our suspicion. The suspicion is that this was not Delta and this was not the original wave. And the reason why we feel good about that is because a year ago, during the first peak, we were seeing percent positive rates around 2%. And that was catastrophic. 2% positivity rate had us with field hospitals in New York City, had us with field hospitals in major metropolitan areas. 2% positivity rate had us running out of ICU beds and ventilators, and not enough places to put all the bodies at a 2% positivity rate. We just got through a wave in which we were seeing a 30 to 35 to 40% positivity rate. So clearly what we've seen most recently, right, was not as impactful because our entire way of life would have collapsed if it would have been the same. The question is it because of Omicron? Is it because of natural immunity? Is it because of the vaccination status? All of those things are being considered, and I cannot definitively say why it did not cause as many hospitalizations and deaths as the first wave did. But there's speculation that there was a less virulent strain. Obviously, the fact that many more people were vaccinated this January than January of 21 also played a role. But we'll leave it to the scientists and those that look at the data to help us parse out exactly why this most recent wave was not as deadly.
Thank you so much. One more comment. Thank you for the presentation and the amazing work with COVID. And I believe that's all of our pre-submitted questions. Oh, one last one. If someone tests positive for COVID, what should they do? We've kind of talked about that, but if anybody else would like to elaborate.
Sure. So if they test positive for COVID, then they should immediately isolate. And now the current recommendations for the protocol is that you would have 5 days in isolation. And then once you become without symptoms, that includes being without a fever for at least 24 hours, that you can return to work or school with a mask on.
Okay, thank you. And so that was the last question. And now we will turn it over to Hugh Houghton.
Robin, thank you so very much. Let's everybody give Robin a round of applause for a great moderation of our event this evening.
Thank you.
And thank you all for joining us this evening. The Old North State Just the Facts About COVID-19 webinar. Tonight, you heard about the history of Old North State, the reflection and the next steps in the COVID-19 mitigation. You heard about the economic impacts to the households, and you also heard about health equity. We appreciate your questions, and we trust that you'll leave this evening with an even better understanding of Old North State, COVID-19, and its impacts on the lives of North Carolinians. On behalf of our presenting physicians, thank you so very much for your wonderful, wonderful presentations. On behalf of my colleagues with Old North State, to include Dr. Karen Hargett, our medical director, Natasha Jones, project manager, the entire COVID-19 equity project team, the clinicians, our board of directors, we say thank you. And of course, to you, our webinar attendees, we thank you for attending and participating in our webinar. We have some partners, we have many partners across the state, and I'll share with you a couple of them. I can't name them all, but the Department of Health and Human Services, Bennett College, Healthier Together, NC Counts, Mexican, the Durham Public Schools, El Centro, Co-Response, and the names just continue and continue. They help us to complete our mission each and every day, and we appreciate them and all the other partners that we have across the state. A special thank you to Larry Fairley and his marketing team, MRS, Marketing Resource Solutions, and VK and Magda for working behind the scenes to make sure that this webinar came across as well as it did. And for serving as a host of our webinar, we thank you, MRS. So remember, get vaccinated, get boosted, and get tested. Old North State, trusted since 1887. Thanks for coming, and good night.